Today, we are talking about functional medicine and treatment with leucovorin for autism. I have a special guest, Dr. Richard Frye, who is a Harvard trained child neurologist with an MD and PhD from Georgetown University. He's a national leader and researcher in autism. He wrote a book called The Folate Fix recently. I saw him and his research featured on a CBS News report, and I just love talking to him. It is filled with practical topics. The main one being autism is treatable, and we really need, both as parents and professionals, we need to really dive in a little bit deeper or a lot deeper into the possible treatments to help our kids as much as we can. So today we are focusing a little bit more on leucovorin as a treatment for autism, but there's a lot of insights regardless. And so it's a great interview. I hope you love it. I loved meeting Dr. Frye, so let's get to it. All right, I am so excited to have Dr. Richard Frye on the show. Thank you so much for your time, Dr. Frye.
Well, thank you. Thank you for inviting me.
Yeah, so we chatted a bit. I know a little bit about you in terms of, being Harvard trained and being an MD, PhD, and mostly academia. But can you tell our listeners and tell me how you migrated over doing autism research day and night?
Oh, that's an interesting question. So I usually say that autism found me, and so my story is that after I finished my residency, I was very interested in learning disabilities, and so I did a fellowship in learning disabilities and behavioral neurology, and that was a time when autism. That was, the early 2000s when autism was being more and more recognized. And, nobody really knew all that much. So a lot of patients would come in to the neurology department and they'd, with their children with autism, want to be seen. And of course, the schedulers and people said, well, we don't know what to do with them. Of course, you give it to the fellow you know so um, so I had a lot of parents come in that says, well, my child just got diagnosed with autism. They don't know what causes it. They don't really know what to do about it except some behavioral therapy. Think it has something to do with the brain, so maybe you can figure it out. And I took it as a challenge, and started to actually find out that there's things we could do. There are physiological, biological, medical things that can be addressed that would improve the function of children. And of course, it started out with just one thing, but then another thing, and once you start to build up and you find a few things, it becomes real numbers, real kids that you start to help. And the other thing that happened was, of course, as I went out and actually got a real job, and I was in, mostly academic centers. I would go into departments and I'd come in and my colleagues would say, you know something about autism? Because I got clinics full of them and I have no idea what to do. So you can have all of mine. So my one of my first jobs when I was at University of Texas at Houston, I had to form, which was my first, what I call the medically based autism clinic, because that's all I was seeing.
Yeah, yeah. Well, the rate certainly has gone up. Back when Lucas was diagnosed in 1999, the rate was thought to be about 1 in 500, and now it is now 1 in 31. And then another number that people don't talk about much, but 1 in every 6 8-year-olds has some kind of neurodevelopmental disorder, whether that's autism, ADHD, learning disabilities, so it is happening to a lot. And today we're going to specifically talk about medicine, functional medicine and treatment, and specifically leucovorin treatment. But I saw a CBS News special where you and your research were highlighted. pretty recent, a few months ago, and started down the path of looking into it. I actually bought your book, The
Well,
Folate
thank you.
Fix. Um, so so let's start with like you came from a pretty traditional, we've got clinics full of kids and nobody, that would be traditional medicine, research. And now you're more into, would you consider it functional medicine, biomedical medicine? Like,
In some ways, I think it's kind of medicine.
yeah, the real
I
medicine.
I don't think that you have these boxes. We do have traditional medicine, and traditional medicine, works in a certain way. And I think that it has its purpose. But when you have disorders like autism and other disorders that are complex, it doesn't do a really good job. It likes to put things into boxes, and we know that there's certain disorders like autism that don't fall into boxes. They're complex. There's not, as I say, there's not the autism pill, right? I've
Yeah.
had patients that didn't come back for follow-up because they said, "Oh, you didn't give me the autism pill, doctor," and that's how we think about it, right? You get a pill, and there's a good TikTok video actually I have on the autism pill, um, because yeah, it's not that's not how it works. Children with autism are complex, and as you say, you see one child with autism, you see one child with autism, and that's something we really try and convey to parents and other doctors and such. As the title of the book, The Folate Fix, is kind of a fun title. But I want to make sure that people understand that it's not a single pill. Folate is extremely important, and the folate pathways are really important for healing, for the body healing and the body functioning. But all of these things work together. And so you can't just give a pill, you have to look at the whole individual. And many times, unless you have the individual's health optimized, something like, folate is not going to work optimally, leucovorin may not work optimally. So, I have a lot of parents that see it and say, okay, now I can just go out and buy a bottle of folinic acid and give it to my child. Besides the fact that they'd have to give a whole bottle a day to get the dose that they need, it probably won't work for many other reasons, and that's because it's complex, and that's where the complexity is, where many doctors, which I guess you would put more into the functional integrative medicine type category, really try and look at things from all angles to make sure that we have the body working optimally so that the treatments actually work optimally and the child can recover.
Yeah. So, there's a lot of people in my world, like whether they're in my online courses, I have a few high touch coaching participants where I coach them more, I dive in a little bit deeper. And, we've had kids with like very severely low iron or very whatever, when I dive in deep. But, I have been recommending for years that if kids are medically sick, I mean, as a behavior analyst, we are obligated ethically to have the parents have someone rule out medical conditions. And it's like I see posts from behavior analysts, well, medical problems have been ruled out. It's like, no, you can't rule out medical problems. Like that's just a myth, because especially if the child's not fully conversational. Like Lucas can talk a little bit, my son, but he can't say the pain starts here and goes down to my ear, and it's like a throbbing pain, or it's a 9 on a scale of 1 to 10. And and we have kids having major problem behaviors, wearing helmets or staff wearing bike guards, and medically they have got to be really, severely in trouble. But I'm married to a physician. My typical son's a physician now. I'm a nurse. Like, we're all trying our best. So, like, what can parents ask their traditional pediatricians to test. Like I had somebody on the show and I said, at least get like a lead, iron, zinc, copper testing, ask for that. And she did. And the lead was through the roof. Like Department of Health had to come. Like, what can traditional people do, uh, practitioners, medical practitioners do to just at least start looking under the hood?
Yeah, I mean, I think it's hard for them in a lot of ways because we don't have any guidance. Many of the guidance from, the neurology foundations, besides being now, I think, 20 or 30 years old, is absolutely useless. And this is a field medically we haven't moved forward with, and it's very tough. Of course, there are some courses such as the Medical Academy of Pediatric Special Needs MAPS, which Dr. Rosignol started as the president of founding faculty of, and the idea there was to use actually medically based investigations and treatments that had evidence. So using evidence-based medicine to go forward and try and understand the child. Now, and it was a great idea, and now it's been, I don't know, 15 years or so since that is, and it's a great organization, but it's also shows you some of the limitations we have, because the problem is it's great to say we want to use evidence-based medicine, but if you don't have the evidence, you don't have the studies, it's difficult to do that. So in parallel, that's why we started the Autism Discovery and Research Foundation, and that's why we've been doing research for years, is to really try and find what the evidence is. Myself and Dr. Rosignol first got together, writing systematic review papers. So a systematic review is when you look at every paper in the literature on a subject, so you're unbiased, to find out what the evidence was. And we do that all the time because you need to, find out what is out there to guide you. And one of the things we do find is that there just isn't a lot of evidence, and we need to generate that. But there is some. One of the things is that it does take efforts, to actually do this, and that's what you see. There's some pediatricians. When you see the pediatricians, there's some that are just so incredible and embrace autism, and they work hard. And then there's other pediatricians that are more scared, of it and just don't understand it. And unfortunately, the ones that really have the time and the effort to do that, are few and far between, and it's not, the fault of the ones that don't. It's just the way the medical system is set up not to, take care of individuals that have very complex medical conditions. So it's a challenge to actually do the investigations and the treatments. But what I would say to parents is, don't let any stone be unturned. Do your research. Now, of course, that's a bit of an issue because the internet is filled with all types of stuff. The important thing is to find a doctor you trust. Okay. If you don't, it's like anyone, if you don't get along with your doctor, like you don't get along with somebody else, maybe you have to find somebody that you do click with and you trust. Because that's one of the most important things when we think about doctoring, right? It used to not be just giving pills. It was that really relationship between the parent and the doctor, or the patient and the doctor. So you want to find somebody you trust and do your research, and, I wouldn't jump to conclusions, but, have a doctor that will listen to you and give you an opinion one way or the other, and explain to you why, because some things may be helpful and some things not, and so I do think it's challenging, but I know that the success of the child is proportional to how much the parent can advocate for them. And so it's important for the parent to be an advocate. And of course, we like to think that there will be people out there in the medical field or other fields to help us. But for this population, it's usually not there. Again, not for the fault of people, but it is so overwhelming, I think, that the system hasn't been able to catch up with it.
Yeah. And it seems like the maps, which we can link in the show notes, how to get information about maps if you're a physician or a registered nurse or nurse practitioner. Um, it tends to attract people like me who are both a parent and a
Yes.
professional, who are trying initially to just help their child and see the need, to go bigger. But yeah, the maps, I do recommend if and a lot of times the MAP doctors are all private pay, waiting lists, and it's just like it is frustrating. And maybe work with your pediatrician to get some preliminary training
Mhm.
that isn't, too far off. That's why I try to feature, we've done, functional nutrition shows. We can link those in the show notes. Just like you said, don't turn, start turning over stones. Don't, one of the like when we have podcast guests fill out forms, what are some bullet points? And two of your first bullet points, and we're going to get to leucovorin in a second, is autism is treatable and medical problems are important to address. And it's like,
Yeah,
I feel like, that should not be controversial. We're not saying autism can be cured, but the underlying issues that are causing problem behaviors, speech delays, um, poor sleep, picky eating, they can be addressed. And, even my book, Turn Autism Around, people are like, oh, I don't want to turn autism around. I don't want my autism turned around. That's fine for you. And I'm not saying in every case it could be completely turned around. Obviously, it can't. But we should be trying to turn things around, right? In
yeah.
all of these aspects. And so it shouldn't be controversial to say autism is treatable.
Right. No, it shouldn't be. And so one of the things, yeah, I think that is that people don't understand is that autism is defined by symptoms, and we concentrate on that. But there's another criteria for the diagnosis of autism is that it has to functionally affect your life. So if you have the symptoms of autism and it's not affecting your life, you're the CEO of a company, you're a successful engineer or whatever, traditionally, you don't have autism because it's not affecting your life. And so, everybody's different. We all have our quirks. Some of us probably hide it better than others. So, but nobody's trying to take away people's personality. And one of the lectures that I've been doing recently is to say, it's not really the symptoms, it's how much they're interfering with your life. So can we do things, medically to improve the function of your body, your health, so those symptoms are not affecting your life? And then essentially you're at, we have three levels of autism, 1, 2, and 3. You're at level 0. And there, you can go on and live a good life. A couple other things, that you did point out that one of the limitations is this fact that we do have that everything is costly, right? This isn't covered. They don't teach us in medical school. It's not covered by insurance many times. It's hard to get it. There are grants. So MAPS, there's a generous donor that is helping with costs for MAPS if physicians want to start to become a MAPS physician. And there's also other advocacy groups like TACA who gives grants for medical care. So there are ways of helping with those ends of things.
Okay, cool. So, all right, let's talk about leucovorin. You've done a lot of research, and is there a way you can just give us like a 2 minute what leucovorin, what is the issue and what is the treatment?
Sure, and I think we've had success because it's an easy it's somewhat a relatively easy fix, and I don't want to make it's too easy, but it's an interesting story, but in about the beginning of the 2000s, the turn of the century, which is very funny to say, being born in the last century, but there was a very smart doctor, Dr. Rainmakers, who was in Europe. He was very aggressive at trying to find out why children that had neurodevelopmental issues were like that, and what he could do to treat them. And he would do something called lumbar puncture, where he'd look at the CSF, the cerebral spinal fluid that surrounds the brain. And he worked with another a brilliant scientist, Dr. Blau, who is an expert in analyzing CSF. And they noticed that when they analyzed the cerebral spinal fluid, that folate, which is a very, very important vitamin. Of course, we know when you're pregnant, you need to take your folate. Our food is fortified with folate because it's so important. It was low in these children. And so they found an explanation for that, and they didn't know why. Then they did know, though, from cancer therapy. Okay, from cancer therapy, we use drugs that inhibit folate, so we're very good at restoring folate. So there's a drug, folate, a prescription folate called leucovorin that rescues the body. So a lot of people think of it as a cancer drug. That's something we have to kind of get over, but it's the drug that rescues the body from chemotherapy. And we know it gets into the cerebral spinal fluid. So they use this medication to see if they could restore folate, and they found out that these children improved dramatically because they were able to get folate into the brain and bypass the block. So that was the first step, and Dr. Rainmakers, named this disorder cerebral folate deficiency, but he didn't know why. So there is everything that gets into the brain has to get there in a special way. It's a very protected area of our body. So there's something called the folate receptor alpha. So this is a transporter. So it binds onto folate in the blood and it pulls it up over into the brain. And he knew that was the primary way. And of course, he thought the first thing, well, there must be some genetic problem with that. And he did the genetic sequencing and he found there were no problems. Well, interestingly, at the same time, Dr. Quatros at SUNY Downstate in Brooklyn was doing research on neural tube defects. These are things that happen because you don't have enough folate when you have a baby. And it ends up this receptor, this folate receptor alpha, is also on the placenta too. So, and he had discovered that there was this autoantibody. So usually our body have antibodies to protect, from viruses and bacteria, but sometimes we turn on ourselves. Our immune system turns on itself and it makes an antibody to part of our body. This is called an autoantibody. So he identified that some of these women had this autoantibody that was binding to the folate receptor alpha. As he was doing that research, Dr. Rainmakers realized that that might be helpful, and they got together and they found out that these children had this folate receptor alpha in their blood, and that was the folate receptor alpha antibody, in their blood, and that's the reason why the folate was not getting into their nervous system. So, at the same time, as that was happening, I was a budding child neurologist, and I was at University of Texas, Houston, and for children with autism and also neurodevelopmental disorders, we took kind of a playbook out of, Dr. Rainmakers, and also, of course, they're cowboys in Texas, right? So if a kid has a problem, we're not going to stop until we figure it out. And we had a very talented interventional neuroradiologist that could do lumbar punctures very well, with minimal side effects, really just absolutely brilliant. And so we were able to measure these things, and we realized that a lot of the kids with autism were having the same problem. And then, I treated my first patient and just dramatic response. I was treated with leucovorin and it was just dramatic response. And that's when I teamed up with Dr. Rosenville. And we both were seeing children with autism mostly exclusively in our clinics. And so we said, well, how many of these kids are there out there, right? How many of the kids with autism have this autoantibody that's stopping folate from getting into their brain? Is it 5%? Is it 100%? Well, in our first study, which was just using our clinical population, we found out there was 75% of the children with autism had this autoantibody that was potentially stopping folate from getting into the nervous system.
And did they all have to get lumbar punctures, or is there another way to
So,
test that?
right. Luckily, the folate receptor autoantibody is a blood test. And, being a scientist and an academician, the first, kind of way we did it was, well, if you had the antibody, the next thing we would do was do a lumbar puncture to see what the level is, so we can do everything very, precisely. But as we had more, and as you imagine, there's more and more kids, and you can't do all lumbar punctures on them. So, and leucovorin itself, vitamin B, it's a vitamin B9, it's a B vitamin, it's very safe. So eventually we said, we gave the option to the parents, do you want a lumbar puncture or not? And as you would imagine, as we became more successful, people did not. And we reasoned that really it was probably safer to do a trial of leucovorin since it has no serious side effects, than to actually do a lumbar puncture if you had evidence that there was some problem. And that's the folate receptor antibody blood test.
And is that the frat test?
That's the frat test. Now it is known as become. So at that time, of course, Dr. Quatros was doing this in his laboratory, and so as soon as we started to, to build up needing it, it had to be put into a commercial entity. So now it's the frat test, which is commercially available. It's fratnow.com. I believe to
And we can
get it.
put that in the show notes too.
Good.
When I saw the CBS article or news show about your work, about folinic acid, about leucovorin, cerebral folate deficiency, and I'm a neuro nurse, and these things in the past I was a neuro nurse. All these terms, like if you're listening and you're like, oh my God, I get it. Like, and I am already in the field to some degree, but it is a lot. But I did end up getting a frat now test on my son Lucas, who's 20, he just turned 29, and it was negative. So you're saying that 75% of the time with kids with autism, they are positive.
Yeah. So
Okay.
what we found, yeah, in our first study just quickly was that the kids that were positive, that 2/3 of them responded significantly. And of course, that was what we call an open label trial where people know they're getting it. And then the next thing we did when I moved to Arkansas Children's Hospital was do the first double-blind placebo-controlled trial to
Okay.
prove, versus a placebo or sugar pill that this worked. And since that time, we've been doing other research and I'll talk about that in a second, but in the time we've been doing some other research on a different formulation of leucovorin. There's been 4 other placebo-controlled studies that have confirmed that. So now we have good evidence that this is not just something that is just a one-off. And what we're doing now so then we have several multi-center trials, which we're just ending up on something called levoleucovorin, which is the purified form of the drug.
Okay.
And it's in a form that's very easy to give. And then one of the things that we found along the way is that really it's important for autism to have its own specific form of leucovorin. So the problem is that we use in the commercially leucovorin calcium. Levoleucovorin calcium is the form that we're investigating, but these are all available for other disorders. okay? And the problem is that you can substitute other forms for what we're working on. And that tends to be a problem because children with autism are extremely sensitive.
Yeah.
And these other forms many times can cause no effect or can cause side effects. So
Yeah.
right now, we only can go to compounding pharmacies, so to make sure that it's pure. And we know that even that lot is trying to dry up. So we've actually just launched a company to make a specific leucovorin just for children with autism. So in the next 5 years, we hope that we'll have a leucovorin that is just made for children with autism, that can't be substituted, that is tolerated and effective just for the children that need it.
Couple questions. You said they made significant improvements. Can you describe the improvements that these studies are showing?
Sure. So major improvement that we saw initially in our initial study was language. And so we keyed on to that in our double-blind placebo-controlled study, and we showed that verbal communication or language improves significantly in 3 months. So all of our studies are 12 weeks or 3 months. So that's where you have to kind of think of the endpoint. And for those that were positive for the folate autoantibody, that was a 77% response rate. And something called the number needed to treat, how many kids you have to treat to get a response like that, is 1.8, which is an extremely good number. Right, in clinical trials, we have this thing called the number needed to treat, and most people think that must be one, right? You go to the doctor, he gives you a pill, you get better, so the number needed to treat should be one, but it's actually about 6 to 8 in most clinical trials, and that might be surprising to some people. So the fact that we have 1.8 means that about 65% of the children will respond like that. Now, some don't respond with that really significant increase. It doesn't mean they won't. Some are negative for the folate autoantibody. So the folate autoantibody is the major reason that we find in children with autism. But there's other issues, including problems with mitochondria and other metabolic systems. Okay, there are genetic changes that also could do this too. There's also, as I think we talked about in the beginning, there's medical disorders. If you haven't taken care of sleep, if you haven't taken care of the GI tract, which could be better, you're not going to see that response. So that's why, it's a not, as I like to say in the beginning of my lectures, don't do this at home. It's something that you really need guidance for, unfortunately, and it's something that's complex. And of course, we're trying to, educate doctors as, the book was it just happened to be that the whole CBS thing happened when the book was coming out. So it was good timing. I've been working on that for 2 years, on that book. We've launched the metabolic learning resource where the book comes out of, where we want to put more webinars and information on to start educating doctors so that they have, so they can at least, they don't have to, let's say, become a MAPS fellow, which takes years. That would be great, but some people don't have the time. This is something they can do, some type of courses. They can get some information to at least, use this solution for their children or for their patients.
Have you studied or noticed any improvements also in reduction of problem behaviors or sleep improvements or sensory sensitivity, self-care?
Yeah, so all of the above. Definitely some of the other trials have had different outcomes. So one trial just looked at core autism symptoms and saw that improved. Actually 2 trials. One used something called the CARS, which is an outcome, and the other one used the ADOS, which is the gold standard, and showed the study from France. So we do see that there's other improvements too. And what we do find is that, it's very important if you can improve communication. If you can improve the child's communication, you will decrease a lot of problem behaviors. One, you can know if they're having other problems that you could fix, but also a lot of that behavior, that we see as disruptive isn't so disruptive. It is a form of communication. It's
Yeah.
frustration, and so if you can get the child, even if they're not going to talk with leucovorin, if you can get them to communicate in other ways, it's really going to help them and improve their symptoms.
Yeah, that's great. Yeah, and before we hit record, I talked to Dr. Frye about my digital assessment, the BECA, the Barbera Early Childhood Assessment, which I think I'm going to follow up and hopefully, but that is free still, marybarbera.com/assessment. We'll put that in the show notes as well. But that is a quick snapshot that parents can do easily in under 10 minutes that can measure a lot of things pre and post. So I'm excited to see if that's a good fit for your research, and I think it will be. But this is very exciting. Did with this with the lumbar punctures, with the cerebral spinal fluid, did kids with more severe autism have worse folate than kids with higher language and higher skills?
So we do, I don't know that that correlation has specifically been made. In general, yes, that the kids with more severe deficits in folate seem to have more severe, particularly neurologic problems, intellectual disabilities, seizures.
Okay.
Okay. And they can make improvements in those also. Recently, we found that one of those folate autoantibodies, the binding antibody, is actually proportional. It predicts one, severity, and two, response to leucovorin. So yeah, we are starting to find that these biomarkers will allow us to one assess severity, and also I know who's going to be the responders and who would probably do well on other treatments. So it's taken some time. When we first did our first paper, we thought it'd be a couple of years with everybody using it, but things move slowly. But I'm just glad that you recognize this so we can tell everybody about at least one of the things that can help.
Yeah. So next steps for parents, I mean, check the show notes. We're going to have your website, autismdiscovery.org, information about the maps, information about, we can put the CBS news special
Sure, we
there.
had we had a
Uh,
Fox too. There's a couple articles too I can
okay.
send you up in
Okay,
the New York
great.
Post.
So we'll put that all in the show notes of how to get the book. Although the book is pretty meaty, I think for parents, it's going to be hold on tight. But anything else parents can do, just dig in and start looking into, like you said, this isn't the magic pill for all kids with autism. Like I get excited and I got the protest and, you know, but that doesn't mean like this is totally off the table. Like we just have to keep moving forward and like it doesn't have to be like this is your next, 12 months of your life. I'm going to dig in so deep that I lose my, you know.
So the really important thing, I really, appreciate you saying that, because the really important thing is that parents find an advocacy group that they can join so that they have other parents to talk to.
Yeah.
Okay, so there's a lot of parents just feel all alone. They don't know which direction to go in. So it's very important to actually connect with an advocacy group in your area. Of course, TACA is all over. It's in I think every state. There's other advocacy groups though too. Autism Speaks has a lot of good, information. So these are all really important things to do, is to really get connected in your community, because it's autism is not something that just affects one individual, it affects the whole family.
Yeah. Yeah. Yeah, I totally agree with that. We have a really strong Autism Society Facebook group and they do music therapy and they have special events at museums and amusement parks. So like definitely I agree with that. I think we can't lose sight. We can't throw ourselves overboard. We have to put our oxygen mask on first. So that might be a great way to end it. I like to squeeze this in. So part of my goals is not to just help the kids, but also help to the parents and professionals and physicians that are listening. So what stress reduction tools or self-care tools do you use, Dr. Frye, to help you stay happy and with less stress?
Yeah, no, I think it's very important that that you think about yourself. And I even talk to parents about this. You think about how to do the things that you like to do. I think a lot of us, you get into adulthood and just working so hard and you forget those things that you enjoy. And I think it's important to rediscover it, so that you get the enjoyment, because unless, as you say, unless you have not even your oxygen mask, unless you feel joy in your life, you're not going to be able to give it to other people. So you want to find ways of really making sure that you have your time to refresh and recharge.
Yeah. Well, I think that is a great way to end. Thank you so much for your time. I loved getting to know you better, and I'm sure my listeners are going to love it too. So thank you.
Thank you.